Okay, here we go. AVF part 4. And in part 4, we are going to start from the understanding of single field analysis printout. And today we are just going to discuss about patient data and test data. Okay, so this video is based on basically just gross outline of single field analysis, and main topic is patient data and test data. Okay, what is printout result? So basically, we have to understand what is stat pack. So statistical analysis of patient result is done, and this package is available in Humphrey. It's called stat pack. Basically, statistical analysis is done by stat pack, which is basically statistical analysis of the software of the Humphrey. So greatly simplified visual field interpretation is by differentiating between normal and abnormal visual field. Okay, they will differentiate it and identify significant change in serial visual field change, and it's not covered in the single printout. It's covered in the serial visual field changes, and also determine whether the patient's visual field results fall within the range of normal limit to his age. That's why age is very important, isn't it? So the analysis of the data required present the following format. The very famous is single field analysis, and after three consecutive tests, we can do change analysis, overview glaucoma change. We can do even two, and the glaucoma change printout we can. I think it's three, but I'm not confirmed. We will see in later on video. The single field analysis is devoted to analysis of single field. That's what we are talking to do. We are about to do, but it will take, I think, maybe 5 or 7 videos. Okay, so change analysis and overview are used to interpret the multiple field obtaining different time. Okay, fine. It needs at least different time to have at least change analysis, isn't it? At least two minimum. So here is how we can think about it. It's again taken by JR Reddy. So Humphrey visual field test printout. One thing we can see is screening test printout. Okay, so the normative data is available to screening test, no stat pack analysis. So basically, screening test means we are going to do screening only. There is nothing otherwise. But at the same time, threshold printout test printout means we determine each point threshold. So depend on the availability of normal data and the measure of retinal sensitivity raw data analyzed by what stat pack. So it depend threshold printout that stat pack has that availability of normal data or not. Okay, so raw data with stat pack analysis and raw data without stat pack analysis. See, these are two things, because without means stat packs doesn't have the normative data, and with analysis means it has normal data. Okay, so single field analysis printout, overview printout, and change analysis printout, and glaucoma probability analysis and glaucoma progression analysis, these are all things we done when stat pack has normative data. They have raw data and normative data. And when there is without stat pack analysis means, what are the things? The macular program printout, nasal step printout, and all other printout conducted in stimulus 5, not in 3. Basically 3 is stimulus size 3 means standard, but any test we have done by stimulus size 5, there will be no analysis by statistical analysis. Okay, raw data can be analyzed in statistical pack. So the normative data is available to the tests that are conducted with the following parameter. The stat pack, that is Humphrey field analysis paper, will analyze the parameter in listed. Test pattern, normative data, it has central 30-2, 24-2, 10-2. It has that. Okay. Test strategy like SITA standard, SITA fast, full threshold, stat pack, fast pack. It has that. Stimulus size 3, not 5. Definitely 3 has that thing. Fixation target, central, small diamond, or big diamond. It has that uh, normative data. Foveal threshold, on or off, they has that. Fluctuation, on or off, they has that normative data. Okay, so single field analysis, let's come to single field analysis and interpretation. Whenever we come to single field analysis and interpretation, there are two things that is very important to understand. One zone that are independent of normative data. It's very important. Just remember, it's very important that one zone is independent of the normative data and stat pack analysis. Okay, this zone, this four zone, they don't care about normative data, whether there is normative data or there isn't normative data. And these 6 zones, they depend upon the normative data and the statistical analysis. Okay, so these four zones independent of the normative data. What independent? Test data and patient data. Definitely, that's what we are going to talk about. Zone one. Zone two, reliability index. It doesn't matter. Independent. It is independent of the normative data. Raw data and grayscale. These are also independent of the normative data. So it doesn't matter normative, whether there is a normative data or not for these four. And the six others, the fifth, total deviation numeric plot, total deviation probability plot, pattern deviation numeric plot, pattern deviation probability plot, global indices, as we have known global indices, pattern standard deviation, and mean deviation, short-term fluctuation, a corrected pattern standard deviation, these all things. And the last is glaucoma hemifield test. That is basically we have five outside the normal limit, borderline, abnormal low sensitivity, abnormally high sensitivity, within normal limit. And these six zones depend upon the normative data. Okay, just remember. I will later on again I will come. This is again taken from the GRAD. So this is how it looks. There are 10 zones. Okay, there are 10 zones, and this is again taken from GRAD. First zone is patient data. Second zone, heavy in the left, is reliability data. Third zone is presented retinal sensitivity at a selected point, raw data. And fourth zone uh, is presented in sensitivity showing sets. These four zones doesn't matter. It doesn't independent. They are they are independent. They are independent of the raw data. They are independent of the normative data, whether StatPack has or not. And now we come to the fifth, total deviation numeric plot. Six, total deviation total deviation numeric plot. Six, total deviation pattern deviation numeric plot. Seven, pattern deviation numeric plot. Eight, pattern deviation probability plot. So these are probability plot and numeric plot. Okay. um, and what do you have? 7, 8, 9 global index. There is no okay, global indices, I'm sorry, not reliability indices. And 10 is glaucoma hemifield test. So even you can see this, is it, this is normative data, normal uh, personal data plus uh, test data, reliability index, raw data, grayscale, total deviation numeric plot, pattern deviation numeric plot, total deviation probability plot, pattern deviation probability plot, global indices. And here where is that glaucoma hemifield test? I think it's left. Glaucoma hemifield test should be there. I don't think it is there. Okay, fine. Okay, so let's discuss about the first thing, the normative data and the test data. Okay, so it's very important that you understand these things. See, name, age, and gender is very important. The age and gender we will definitely going to talk about, and we need name, isn't it? So date of birth, which is very important, which definitely going to correlate with the age of the patient and the normative data eventually. And pupil size is very important, at least 2.5 to 3 mm, not below 2 mm, and we will definitely going to discuss about it. Visual acuity is definitely going to correlate with the macular sensitivity, isn't it? Foveal sensitivity. Refractability, another. Test perform in strategy, that's very important, because we cannot do follow-ups if the first follow-up is 30-2 and second follow-up in 20-2. It's very difficult to judge to printouts, isn't it? Yes. Stimulus size and color is very important. Normally, third stimulus size, third size of Goldman stimulus is normal. So fixation target is very important, where we are fixating. Normally, test perform and the stimulus target are very fixed, isn't it? And it's dependent on what we have selected. So again, it's from GRAD. It looks like this. Named data, date of birth, pupillary diameter, visual acuity, refractive correction for the near, fixation monitoring, fixation target, color stimulus white, and background illumination is always 31.5, isn't it? That's 31.5 apostable. Stimulus size Goldman 3. Okay, it's very important. Whether 3 is a very standard. So let's discuss about the fixation target. There are four types of fixation target, and uh, at very early stage of your learning as a student, it's very difficult that which target should I do, and there are a lot of things you see into the machine, and it's very difficult for us to teach patients. It's quite difficult sometimes, but don't worry about it. Central is yellow light at the center of the ball, and most of the time you will use. Okay, small diamond, when to use? It's a location below the central target and should be used when a patient cannot see the central fixation light. Like example, macular degeneration. And patients should look in the center of the diamond formed by four light, isn't it? That's a small diamond. Yes, that's the small diamond. And then can you see this large diamond? This one again. This comes large diamond. It is located below the central fixation and it is used for the patient with a central scotoma and who cannot see either central fixation light or small diamond. So if they can see small diamond and they can central fix it, then we will go to the large diamond. Okay. So for bottom LED, what is bottom LED? Some tests have point in the superior visual field that requires lower fixation light than the central target. The target is used the bottom LED and the large diamond when testing the superior 64 degrees or 6 degree and this default fixation target. It is automatically illuminated at the beginning of the test. And that's the bottom LED, but I don't think I have used particularly bottom LED in many cases. That's why I'm just unfamiliar with the bottom LED. Let's move further. Okay, just you know that there are four types of fixation target, and it's important to understand what are the different types and when we should use. Okay, I think that's all there is. So the size of the stimulus is very important. See, the standard of the size of the stimulus is always Goldman 3 for all routine tests. But in situation like advanced glaucoma or whether there is a problem in actually macular test, so test can be conducted with size 5, which is very high, very large size, isn't it? I think 64 mm square is size in size 5. I hope so. So to know the status of macular split, is there a problem with the macula? So if you do change the size from 3 to 5, then you have to know there is no normative data in stat pack for size 5. So age of the patient, see, it's very important since the analysis of raw data by stat pack is age dependent. So if you throw age 30 years some patient, then it will match with the 30 years patient data. And if you throw the patient 30 years, a patient actually 70, then there is mismatch and there will be great problematic analysis, isn't it? So it's very important to enter the age of the patient accurately, that is date of birth, isn't it? But if you enter the wrong data, suppose if you enter the wrong data, is all single print analysis is going to the dustbin? No, 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 that's exactly no. Why? Because we know from the first, I think, four-fifth slide that first half there are four indices that's independent of the normative data, and there is one thing that is raw data and grayscale, isn't it? It's patient data and reliability index. These two things is useful even if you enter wrong data, and then rest of six things that's will definitely go for the dustbin. So that's how important to put correct date of birth. It's very important, but if you put wrong date of birth, then raw data and grayscale, that's useful, even you can analyze from there. Okay, that's very important. Effect of the size of the pupil. See, remember this. Normally, the size of the pupil should be between 3 to 4. That's always there. Constricted pupil is thought to give rise diffuse visual field depression or age scotoma as central important. You will be asked definitely if there is constriction, especially constriction less than 2 mm. If there is less than 2 mm constriction and even there is a media opacity for that patient or especially in visual axis, there will be definitely be problematic. So it is recommended that if less than 2 mm size patient should be dilated before conducting test. And another very important point that you must understand, to note the size of the pupil, very important, particularly in follow-ups. See, first test is done at 3 mm, second test is done in 1.5 mm, particularly for example 1.5 mm. Then you must understand why from first test to second test there is a visual field loss. It's very important whenever you compare the two tests. You have to understand the test strategy is same, reliability index is there, time consumed is there, pupil size. Okay, that's important. Refractive error. See, the patient's near refractive error must be properly corrected. Otherwise, the visual field will be so generalized depression or possibly scotomas. But at the same time, whenever you correct the lens, correct with the large aperture lens. But at the same time, besides the correction refractive error, check the glass is properly placed in front of the eye. And if it is not placed properly, then we will definitely going to create a ring scotoma and all these things. So it's very important that you correct the refractive error, but at the same time it's very important you place the correcting lens close to the patient without touching their eyelashes, and at the same time just know that it's very important, otherwise you will create, if there is some mismatch, otherwise you will create the visual field defect. It's very very important. Okay, so that's it for, and next video we will definitely talk about reliability index. So I have taken a lot of reference from G.R. Reddy, and that's this book. Just grab this book and read if you are into the visual field. Okay, and this is great, another book. Okay, just read this book if you are, if you want to good with Humphrey visual field. Okay, bis dann, tschüss.